Today we are going to talk about performing a central line blood draw and cap changes. So before I would do anything, I would want to make sure to review and verify the physician's order. I want to identify the type of vascular access device that is in place. I want to assess the area for the skin integrity and any signs or symptoms of infection. And I also want to review the organization's port access policy and procedure to determine the flushing and blood drawing procedure. So for Northwest State Community Hospital, we flush our central lines with 10 mLs of normal saline, and then we follow it with 3 mLs heparin flush. So the equipment that I need to bring in the room with the patient is going to be my 3 mLs of heparin. I'm going to need 3 syringes of 10 mLs normal saline. I'm going to have 3 new Lure-Lock caps, and then I'm going to have 1 more 10 ml syringe of normal saline so that I can flush and waste the blood with. And then I'm going to have a vacutainer, and then I'm also going to have my blood tubes, and I'm also going to make sure to label and date those blood tubes. So as I enter the room, I'm going to perform hand hygiene, and I'm going to verify my patient name and date of birth, and I'm going to perform, put my exam gloves on, and I'm going to make sure my patient has a mask on, and I also have a mask on. So as I'm getting ready to do the cap change and blood draw, first I want to prep my equipment. So I'm going to take my normal saline syringe and my new Lure-Lock cap. Now this comes in a sterile container, so when I pick this up, I need to be very careful not to touch either end. So I'm just going to pick it up like this, and then I'm going to take an alcohol swab, and I'm going to clean that. And then I'm going to get the air out of my normal saline, and I'm going to attach this, and then I'm going to prime it until liquid comes out of this side. This is a capped vented tube, so it should be able to prime around that. And then I'm just going to set that there. And then I'm going to do the same with the other 2. So I'm going to pick this up. I'm going to get a new alcohol swab, and I'm going to clean 15 seconds. I'm going to get the air out of this syringe, and I'm going to attach it, and then I'm going to prime it, and I'm going to set that right down on my package. And then I'm going to pick the other one up, and I'm going to clean it with a new alcohol swab. And then I'm going to get the air out of my syringe, and I'm going to attach this to the new cap, and then I'm going to prime it. Okay, so those are ready to go. So now I'm going to assess my line, and I need to see which one I am going to draw the blood out of. It is normally the lumen that is the biggest lumen, so I'm looking for identification on these lumens. It says, so this one is an 18 gauge, this one is a 16 gauge, and this one is a 18 gauge. So normally with blood draws, you use the biggest lumen, which would be the 16 gauge, and it's normally the distal one as well, which it's labeled distal. So that's the one I'm going to start with. So I'm looking, and I see that it is clamped. All of my lines are clamped. So I'm going to pick this up, and I'm going to clean the site for 15 seconds. And I'm going to pick up my normal saline syringe, and I'm going to get the air out. I'm going to attach this to the cap. I'm going to unclamp it, and then I'm going to inject 2 mLs, and I'm going to then pull back to make sure that I do have a blood return, and I do. So I'm going to then inject the rest of my normal saline with a push-pause method. So once I have that all injected, I need to draw back the same amount of waste that I used to flush it with, because if I were to attach the vacutainer now and draw the blood out now, I would just get diluted blood, so it would be an inaccurate blood level. So I'm going to just pull back slowly and steadily till we get to the 10 ml mark, And then I'm going to clamp this, and I'm going to detach this, and I'm going to dispose of this either in the sharps container or your biohazard bag. Now I'm going to get a new alcohol swab, and I'm going to clean for 15 seconds. And then I'm going to attach the vacutainer, and I'm going to unclamp, and then I'm going to attach my blood tubes to the vacutainer, and it will fill up automatically. I'm going to invert this, label, date, patient's name, apply that, it will fill, invert, label, date, patient's name, clamp. So now I'm going to get ready to take the old lure lock cap off. So I have to make sure that this is clamped, and I'm going to loosen it, and I'm only holding on right down here because I don't want to touch up here on the hub. So I'm untwisting this. I have ensured that it is indeed clamped. Take this off, sharps container. I pick up my new lure lock, and I take the cap off, keeping it sterile, keeping this sterile, and I attach it. Once I've attached it, then I can unclamp it, and I inject the normal saline with the push-pause method. I clamp it, disconnect my syringe, pick up my heparin, make sure I got the air out of the heparin, take my alcohol swab, clean for 15 seconds, attach my heparin, unclamp, push, pause, heparin, clamp, and then I disconnect. And if I had one of the cap protectors, if my facility had one of those, I can attach that at this point. Okay, so I'm done with that one now. Now we're going to go to the next one. So it is indeed clamped. I'm going to hold this, twist it, and then I'm only holding down far here at the distal end. I don't want to get anywhere near the hub. So I've disconnected the old lure lock, pick up my saline syringe with my new lure lock, take the cap off, making sure that this stays sterile and this stays sterile. Then I connect this and unclamp, and I put in 2 mLs, and then I pull back to make sure I have good blood return, and then I infuse the rest of the normal saline with the push-pause method. Once that's in, I'm going to clamp it, disconnect my saline. I'm going to get my new alcohol swab and clean the port once again, because I need to follow it with the heparin. So I get my second heparin syringe, and I make sure that the air is all out of that, and then I attach this to the lure lock. I unclamp it and inject the heparin, and then clamp again. Now I am done with that site. So now I'm going to do the last site, and what we want to do again is make sure that this is clamped. And I'm going to hold on down at the distal portion, and I'm just twisting, and I'm keeping my fingers far away from the hub of the needle, and I get rid of this in the sharps container. I pick up my new syringe, make sure that this has remained sterile. I attach it, unclamp it, infuse 2 mLs, pull back to confirm blood return, so it's good, and infuse the rest with a push-pause method. And then I clamp it, disconnect, get my alcohol swab, 15 seconds, get my new heparin, get the air out, attach it, unclamp it, and inject it. And that is how to draw blood from a central line and change the caps.